About last year, I got my third knee surgery, and at that point, there was so much scar tissue buildup to the point where they said that I was most likely going to have to get my knee replaced by the time I was 18. I couldn't take that at the time. It threw me out of myself. I didn't know who I was. I lost a lot. It scared me. I cried. I went into a really, really weird place in my life. I was 15 going through something that no 15-year-old should go through. I was scared and it affected me. If I didn't have hemophilia, in all honesty, I don't think that I would be who I am. And that's why I thank God that I got it.
Ralph Waldo Emerson once said, "What lies behind us and what lies before us are tiny matters, compared to what lies within us." For Isaiah Rivera, a longtime patient with hemophilia, courage and perseverance seemed to come second nature. Because of his disease, he has had to undergo numerous surgeries before the young age of 17. All the while, Isaiah and his family have received care from university hospitals in Cleveland, Ohio. From one of the top 10 hospital systems in the United States, Isaiah's care team is not only providing day-to-day treatment for Isaiah, but also performing groundbreaking research to further science and knowledge regarding hemophilia.
So this patient he's 16. He has a severe bleeding disorder called hemophilia A, so he has deficiency of factor VIII. So it's one of the factors that we need for coagulation of blood, so for blood clotting. And if you don't have that and you're born with it, you are likely to have spontaneous bleeding. The main place that they bleed is into their joints, knee joints, elbow joint, hip joint. He's been struggling with this all his life. He's 16 now. He's had multiple surgeries in his joints. He's very close to getting a replacement of a joint. One of the biggest problems with this disease is that the protein that we need to replace is only available in intravenous form. So it's not available in a pill form. It's a big limitation for a lot of our patients. Imagine this, you're playing a sport and you have to dose yourself, put an IV line on the sidelines before you go out and play. And if you get hurt, you're out right away. There is no time out and go back in. Because if you have hemophilia and you get hurt, you're just out.
Dr. Sanjay Ahuja has known Isaiah for most of his young life and believes the care that he and his hospital team provides will allow Isaiah to live a healthy and productive life.
There is always something you can do for the patient. If it is not curative, then at least it could be palliative. That means I can take care of something. If it is not the cancer or your disorder, I can take care of your pain. I can take care of your suffering. I can make that better. There's always something you can do. Hello.
Hi.
How are you?
We're good.
Good to see you. Good to see you. So
When I was a kid, it didn't seem that bad. I was ridiculously healthy for a lot of my life in the very beginning, and nothing was ever wrong with me. My disease was so under control to the point where they thought I had a moderate disease rather than severe. But I got to a point when I was about 7, I injured my knee. I got tackled by somebody when we were playing football and injured my knee, and I had to get surgery. And my first surgery was nerve-wracking for me. I was about 7, 8 years old, and it was a ridiculously scary experience for someone that young. Going under the knife for the first time really hit me hard. But after that, it kind of just mellowed out. It seemed like this was normal, this was life. But I mean, I've had 7 surgeries already, and it's normal for me.
he's now ready to go back to once a day.
Yes.
you want to get rid of it, right?
He always seemed to put a smile on my face when I was a little
How are you?
kid,
You gonna
whenever
do
I was
yourself?
feeling bad or feeling sick. No matter where I was, he would always know how to joke around with me to the point
Made
where
it a
I'd
problem when he
laugh.
wasn't there.
And
All right, you can sit up
I
that
think
way.
that's probably one of the best qualities you can find in a doctor. Because even when you're at your lowest point, you want someone that's going to be able to make you feel better, even if they don't have to use medicine, and that's what he does.
Open your mouth.
But afterwards, after I got past that, I just focused on making my body a lot more healthy and walking more often. And my knee isn't good, but it's better. I feel like it's been it's a reason why I'm who I am. It made me a better person. I wasn't able to go out and do certain things, so I had to stay inside and learn. And I taught myself a lot. I experienced life from the outside rather than by living it, so I learned lessons before I ever even got to experience the mistakes.
So you realize, right, that he's a little bit unique because he for more reasons than one, but and awesome. But even though we are a hospital that sees patients and runs a business, if for lack of a better word, we do not treat our patients as customers. We need to see a dentist. They become part of our family. Because of the nature of the disorders we take care of. They are with us for their entire lives. So it becomes more of a, they become part of our family, an extended family. Any questions? All right, so we have a plan.
Yes.
Good to see you. How's school going?
It's going good.
Yeah?
Yeah.
Very good.
I just finished that paper I was telling you guys about.
Yeah.
I finished it the other day. I wrote it all the way through. And I guess I did good.
After 7 surgeries and a childhood spent in and out of the hospital, Isaiah Rivera has a bright future ahead of him. His courage and tremendous strength has transcended the burden of his condition. Thanks to Dr. Sanjay Ahuja and the medical staff at University Hospitals, this young man proudly walks, having battled a devastating disease even before finishing high school.
All right, well, one day we'll get there, right? Okay, all right.